Question 1. What is the primary purpose of reinforcement? A. To decrease the frequency of a behavior. B. To increase the future probability of a behavior. C. To signal that a behavior is inappropriate. D. To make a stimulus less desirable. Answer B. To increase the future probability of a behavior. This question is about the definition and purpose of reinforcement, a fundamental concept in ABA. The key phrase here is primary purpose. Reinforcement is any consequence that follows a behavior and makes that behavior more likely to happen again in similar situations in the future. It doesn't matter if it seems like a reward to you. If the behavior increases after it, it's reinforcement. Option A describes punishment. C might relate to certain cues, but isn't the purpose of reinforcement itself. And D describes what happens with certain motivating operations or sometimes punishment. For example, if a child gets a sticker every time they use their words to ask for a toy, and they start using their words more often, the sticker is a reinforcer. Here's the core idea. Reinforcement is all about making a behavior happen more in the future. Question 2. You are asked to record the length of time a client spends engaged in parallel play during a 30-minute session. Which measurement method should you use? A. Frequency. B. Duration. C. Latency. D. Whole interval recording. Answer B. Duration. This question asks about measuring how long a specific behavior occurs. The keyword length of time is your big clue here. Duration recording involves measuring the total amount of time a behavior lasts from its beginning to its end. Frequency is counting how many times a behavior happens. Latency is the time between a cue and the start of a behavior. And whole interval recording is a discontinuous method where you check if a behavior occurred for the entire interval. If you use a stopwatch to time how long the client plays next to peers, you are measuring the duration of parallel play. Remember, duration is for behaviors you want to know how long they last. Question 3. According to the RBT ethical code, who is primarily responsible for designing intervention plans? A. The RBT. B. The client's parent or guardian. C. The BCBA or BCABA supervisor. D. The client. Answer C. The BCBA or BCABA supervisor. This question clarifies the scope of practice and ethical responsibilities for RBTs. RBTs work under the close supervision of a board-certified behavior analyst, BCBA, or board-certified assistant behavior analyst, BCABA. The supervisor is the qualified professional who conducts assessments, develops the treatment plan, and provides guidance. The RBT's role is to implement that plan directly with the client. RBTs do not design plans themselves. While client and parent input is valuable in the process, the clinical responsibility for plan design rests with the certified supervisor. Think of it like a doctor diagnosing and prescribing treatment, supervisor, and a nurse administering the medication and monitoring the patient, RBT. The main point: plan design is the supervisor's job, implementation is yours. Question 4. You are teaching a client to match colors. You hold up a blue card and a yellow card and say, "Touch blue." You physically guide the client's hand to the blue card. This physical assistance is a type of A. Reinforcement. B. Prompt. C. Consequence. D. Extinction. Answer B. Prompt. This question is about the different supports you might use to help a client perform a skill correctly. The action of you physically guiding the client's hand is providing assistance before the client performs the full independent response. This assistance is called a prompt. Prompts are helpful cues or supports that increase the likelihood of a correct response. Reinforcement and consequences happen after the behavior. Extinction is stopping reinforcement for a behavior to make it decrease. Guiding the hand is a physical prompt designed to help the client make the right choice. Remember, Prompts are help you give before or during the behavior to make the right answer more likely. Question 5. A graph that shows the total number of responses recorded over time, with the line never decreasing, is called a bar graph, B, scatter plot, C, cumulative record, D, line graph. Answer: C, cumulative record. This question asks about a specific type of graph used in ABA that tracks the overall count of a behavior. A cumulative record is a line graph where each data point adds to the previous total count. Because it adds up the total responses, the line will always stay flat or go up, never down. This type of graph is useful for showing the rate of a behavior over time. While a general line graph shows changes over time and can decrease, a cumulative record specifically shows the accumulation of responses. Bar graphs and scatter plots are used for different types of data display. Think of a running total score in a game. It only goes up. Here's the tip. Cumulative means adding up, so the line on a cumulative record keeps climbing or stays flat. Question 6. The C in the ABC data collection method stands for A, count, B, criterion, C, consequence, D, Q. Answer: C, consequence. This question tests your knowledge of the basic three-term contingency used in functional behavior assessments and data collection. ABC stands for antecedent, behavior, and consequence. The C specifically refers to the event or stimulus that occurs immediately after the behavior of interest. Recording the consequence helps you understand what might be maintaining the behavior through reinforcement or punishment. Count is a type of measurement, criterion is a goal level, and Q is another word for antecedent or SD. Understanding ABC helps you figure out why a behavior is happening. Remember, ABC is antecedent, what happens before, behavior, what the person does, and consequence, what happens after. Question 7. Reinforcement is delivered after a specific, predictable number of responses. For example, every fifth correct response receives reinforcement. This is a blank schedule of reinforcement. A, fixed ratio, FR. B, variable ratio, VR. C, fixed interval, FI. D, variable interval, VI. Answer: A, fixed ratio, FR. This question describes a fixed ratio schedule of reinforcement. Fixed means the number is constant and predictable, and ratio means the reinforcement is based on the number of responses completed. The example explicitly states every fifth correct response, which is a set number. Variable ratio means the number changes. Interval schedules, phi, VI, are based on time passing, not response count. FR schedules often lead to a pause in responding right after reinforcement is delivered, followed by a high rate of responding to reach the next reinforcement. Think of getting paid $1 for every 10 envelopes you stuff. You get paid after a fixed number of responses. Here's the tip. Fixed ratio means the number of responses is always the same for reinforcement. Question 8. When defining a behavior to measure, it should be described in a way that is observable and measurable. This characteristic is called A, subjective, B, opinion-based, C, topographical, D, objective. Answer: D, objective. This question asks about a key characteristic of a good behavior definition. An objective definition is one that is based on observable and measurable facts, free from personal opinions or interpretations of feelings. It describes the physical actions of the behavior so that anyone watching would agree on whether it occurred. Subjective and opinion-based are the opposite of objective. Topographical refers to the form or what the behavior looks like, which is part of an objective definition, but objective is the overarching term for being based on observable facts. Defining a behavior objectively is crucial for accurate data collection. Remember, an objective definition is like describing what a video camera would see. Question 9. A client engages in disruptive behavior. As a result, the therapist removes a preferred toy from the client for a brief period. In the future, the disruptive behavior decreases. This is an example of A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer D. Negative punishment. This question describes negative punishment. Punishment means the behavior decreases in the future. Negative means a stimulus was removed or taken away. In this scenario, the preferred toy, a pleasant stimulus, was removed after the disruptive behavior, and the disruptive behavior decreased in the future. Positive reinforcement adds a pleasant stimulus to increase behavior. Negative reinforcement removes an unpleasant stimulus to increase behavior. Positive punishment adds an unpleasant stimulus to decrease behavior. Since something desirable was taken away to make the behavior less likely, it's negative punishment. Here's the rule. Punishment makes behavior go down. Negative takes something away. Put them together. Negative punishment takes something away to make behavior go down. Question 10. Teaching a new skill by reinforcing successive approximations. Steps that get closer and closer to the final desired behavior is called A. Chaining. B. Shaping. C. Prompting. D. Generalization. Answer B. Shaping. This question asks about a specific teaching procedure used for new behaviors that don't currently exist. Shaping involves reinforcing behaviors that are increasingly similar to the target behavior until the client performs the final desired behavior. You reinforce small steps toward the goal. Chaining is teaching a sequence of existing behaviors. Prompting is giving help. Generalization is performing the skill in new situations. Shaping is like teaching a baby to say water. You might first reinforce wa, then walla, then water. You're shaping their vocalizations towards the target word. Remember, shaping is like sculpting a behavior. You reinforce closer and closer versions until it's just right. Question 11. The time between a cue, SD, and the start of the client's response is called A. Duration. B. Frequency. C. Latency. D. Interresponse time. IRT. Answer C. Latency. This question asks for the specific term for the time it takes for a behavior to start after a specific instruction or cue. Latency is the measure of time from the presentation of a stimulus, like touch blue or come here, to the initiation of the behavior. Duration is how long the behavior lasts. Frequency is the count of the behavior. Interresponse time, IRT, is the time between two instances of the same behavior. If you say touch nose and time how long it takes the child to start moving their hand towards their nose, you are measuring the latency of their response. Here's the tip. Latency is about how quickly the behavior starts after the signal. Question 12. When teaching a multi-step skill, like washing hands, by teaching the last step first, then the second to last step plus the last step, and so on, this is called A. Forward chaining. B. Backward chaining. C. Total task chaining. D. Shaping. Answer B. Backward chaining. This question describes a specific method for teaching a sequence of steps that make up a larger skill known as a behavior chain. In backward chaining, the RBT completes all steps except the last one, prompts the client to do the last step, and reinforces them. Once the client masters the last step, the RBT does all steps except the last two, prompts the client to do those two steps, and reinforces. This continues backward through the chain until the client can do the first step independently. The advantage is the client always finishes the chain with the step that leads directly to reinforcement. Forward chaining starts by teaching the first step. Total task teaches all steps in order in every trial with prompts as needed. Shaping teaches new behaviors, not sequences. Think of learning to tie shoes. In backward chaining, someone else does all the loops and knots, and you just pull it tight to finish and get praised. Here's the takeaway. Backward chaining teaches the chain by starting with the last step. Question 13. Which type of discontinuous measurement records whether a behavior occurred at any point during the entire interval? A. Whole interval recording. B. Partial interval recording. C. Momentary time sampling. D. Frequency. Answer. B. Partial interval recording. This question asks about a specific discontinuous measurement method. In partial interval recording, you divide the observation time into small intervals, example 1 minute, and you mark whether the behavior occurred at any point within that interval, even if it only happened for a second. This method tends to overestimate the duration or total occurrence of behaviors. Whole interval recording requires the behavior to occur for the entire interval. Momentary time sampling checks for the behavior only at the end of the interval. Frequency is continuous measurement. If a child flaps their hands for just 10 seconds during a 30-second interval, you mark the entire 30-second interval as containing hand flapping using partial interval recording. Here's the tip. Partial means if it happens for just a part of the interval, you check the box for the whole interval. Question 14. If a behavior occurs and an unpleasant stimulus is added immediately following the behavior, and the behavior decreases in the future, this is an example of A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer. C. Positive punishment. This question defines positive punishment. Punishment means the behavior decreases in the future. Positive means a stimulus was added or presented. In this case, an unpleasant stimulus was added after the behavior, and the behavior decreased. Positive reinforcement adds a pleasant stimulus to increase behavior. Negative reinforcement removes an unpleasant stimulus to increase behavior. Negative punishment removes a pleasant stimulus to decrease behavior. If a child throws a toy, behavior, and you make them sit in a corner, unpleasant stimulus added, and they stop throwing toys. Sitting in the corner was positive punishment. Here's the rule. Punishment makes behavior go down. Positive adds something. Put them together. Positive punishment adds something unpleasant to make behavior go down. Question 15. The environmental event that occurs immediately before a behavior is called the A. Consequence. B. Behavior. C. Antecedent. D. Reinforcer. Answer. C. Antecedent. This question refers to the first part of the ABC contingency. The antecedent is the stimulus or event that happens right before the behavior you are interested in. It's the trigger or the context for the behavior. The behavior is what the person does. The consequence is what happens right after the behavior. A reinforcer is a type of consequence that increases behavior. Understanding antecedents helps you predict when a behavior might occur and potentially make changes to the environment before the behavior happens. For example, if seeing a preferred toy, antecedent, leads to a child asking for it, behavior. Seeing the toy is the antecedent. Here's the takeaway. The antecedent is the A in ABC. It comes right before the behavior. Question 16. What is the main ethical concern with using punishment procedures? A. They are illegal. B. They do not work. C. They can have negative side effects and may not teach replacement behaviors. D. They are preferred over reinforcement. Answer. C. They can have negative side effects and may not teach replacement behaviors. This question addresses important considerations when using punishment, especially in ethical practice. While punishment can be effective in quickly decreasing behavior in certain situations, ethical guidelines emphasize that it should be used cautiously, usually as a last resort, and always paired with reinforcement of appropriate alternative behaviors. This is because punishment can lead to unwanted side effects like aggression, emotional responses, or avoidance of the person delivering the punishment, and it doesn't teach the client what to do instead. Punishment is not illegal and can work, but ethical application involves careful consideration of potential risks and ensuring a focus on teaching alternative skills. Reinforcement is generally the preferred intervention strategy in ABA. Here's the crucial point. Punishment has potential downsides and ethically must be used carefully and alongside teaching what to do instead. Question 17. A client learns to say cookie when they want a cookie. Later, they start saying cookie when they want other snacks like crackers or chips. This is an example of A. Discrimination, B. Generalization, C. Extinction, D. Prompting. Answer: B. Generalization. This question describes generalization, which is when a learned behavior occurs in situations or with stimuli different from those used during training. The client learned to say cookie specifically for cookies, but the behavior is now happening for other similar stimuli, other snacks. This is stimulus generalization, where the response occurs in the presence of stimuli similar to the original SD. Discrimination is the opposite, responding differently to different stimuli. Extinction is stopping reinforcement, and prompting is providing help. Teaching for generalization is important so skills are useful in the real world. Think of learning to wave hello to one person and then waving hello to everyone you see. That's generalization. Here's the tip. Generalization is when a skill spreads to new situations or things. Question 18. Reinforcement is delivered after an unpredictable number of responses, changing from one reinforcement to the next example, sometimes after 3 responses, sometimes 7, sometimes 5. This is a blank schedule of reinforcement. A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FI. D. Variable interval, VI. Answer: B. Variable ratio, VR. This question describes a variable ratio schedule. Variable means the requirement changes unpredictably, and ratio means the reinforcement is based on the number of responses. The phrase unpredictable number of responses is the key. Fixed ratio has a predictable number. Interval schedules are time-based. VR schedules are known for producing high, consistent rates of behavior because the client never knows which response will lead to reinforcement, so they keep responding. Think of playing a slot machine. You might win after any pull, but you don't know which one, so you keep pulling. Here's the tip. Variable ratio means the number of responses needed keeps changing. Question 19. When collecting data on a behavior, using clear, measurable descriptions instead of interpreting feelings is part of being. A. Subjective. B. Opinionated. C. Objective. D. Qualitative. Answer: C. Objective. This question again focuses on the importance of objective data collection and behavior description. Being objective means focusing on facts that can be observed and measured directly, without letting your personal feelings or interpretations influence your recording. This is essential for accurate and reliable data. Subjective and opinionated are the opposite. Qualitative data is descriptive, but objective specifically refers to being factual and unbiased. For example, instead of saying the client was frustrated, you would say the client threw the puzzle piece and vocalized loudly, which is an objective description of observable actions. Remember, good ABA data is objective, just the facts, no feelings. Question 20. What must an RBT do if they are asked to implement a procedure they are not trained to do or feel uncomfortable doing? A. Try their best to implement it anyway. B. Tell the client or family they cannot do it. C. Immediately inform their supervisor. D. Look up how to do it online. Answer: C. Immediately inform their supervisor. This question addresses an important ethical responsibility related to competence and scope of practice for RBTs. RBTs must only implement procedures they are trained and competent to perform. If a supervisor asks you to do something you don't understand, haven't been trained on, or feel uncomfortable with, for safety or ethical reasons. Your responsibility is to communicate this immediately to your supervisor. You should not attempt procedures you aren't qualified for. Tell the family you won't do it without discussing it with the supervisor first, or rely solely on online searches for training on specific client procedures. Your supervisor will provide the necessary training or adjust the plan. Your main point of contact and guidance is your supervisor. Here's the takeaway. If something in the plan doesn't feel right, or you don't know how to do it, ask your supervisor right away. Question 21. Stopping the reinforcement for a previously reinforced behavior is the definition of A. Punishment. B. Extinction. C. Reinforcement. D. Motivating operation. Answer B. Extinction. This question asks for the definition of a specific procedure used to decrease behavior. Extinction is the process where a behavior that was previously reinforced is no longer followed by that reinforcement. When the reinforcement stops, the behavior is expected to decrease over time. Punishment involves adding or removing a consequence to decrease behavior. Reinforcement increases behavior. A motivating operation changes the value of a reinforcer. If a child used to get a cookie every time they cried, reinforcement, and you stop giving cookies when they cry, you are putting the crying on extinction. Remember, extinction is cutting off the behavior's supply of whatever was keeping it going. Question 22. You are teaching a client to follow the instruction, clap your hands. You say the instruction and immediately physically guide their hands to clap. On next trial, you only touch their elbows to prompt. You are using what prompting strategy? A. Least to most prompting. B. Most to least prompting. C. Time delay. D. Stimulus fading. Answer B. Most to least prompting. This question describes the specific prompting strategy based on the amount of assistance given. In most to least prompting, you start with the most intrusive or helpful prompt, like full physical guidance, and gradually reduce the level of assistance on subsequent trials as the client starts to respond more independently. Least to most starts with the least intrusive prompt and only increases help if needed. Time delay involves waiting a bit after the SD before prompting. Stimulus fading involves changing the stimulus itself. Starting with full physical, most, and moving to less physical assistance is clearly most to least. Think of teaching someone to do a gymnastics move. You might fully spot them first. Most help, then only lightly spot, then just be ready to spot. Least help. Here's the tip. Most to least starts with the most help and takes it away over time. Question 23. A client is working on sorting objects by color. When they correctly put a red block in the red bin, they get praise and a small piece of candy. The praise and candy are examples of A. Antecedents. B. Behaviors. C. Consequences. D. Prompts. Answer C. Consequences. This question is about the ABC model again, specifically what happens after the behavior. Consequences are the stimuli or events that immediately follow a behavior. Praise and candy are consequences that, because they were delivered after the correct sorting behavior and are likely to make that behavior happen more in the future, function as reinforcers. Antecedents come before the behavior. The behavior is the action itself, sorting the block. Prompts are help given before or during the behavior. What happens right after the client puts the block in the bin is the consequence. Remember, consequences are what happen after the behavior. Question 24. Which ethical principle relates to avoiding conflicts of interest and not having personal relationships with clients or their families? A. Confidentiality. B. Maintaining competence. C. Professional boundaries. D. Beneficence. Answer C. Professional boundaries. This question asks about the ethical rule regarding the nature of your relationship with clients. Professional boundaries refer to maintaining a strictly professional relationship, avoiding dual relationships, where you have both a professional and a personal relationship, like being friends, and avoiding conflicts of interest. This is crucial for protecting the client and maintaining objectivity. Confidentiality is about privacy. Maintaining competence is about skills. Beneficence is about doing good, not being friends with a client's parent on social media or accepting large gifts falls under maintaining professional boundaries. Think of keeping your work life and personal life separate when it comes to clients. Here's the takeaway. Professional boundaries are about keeping your relationship with clients strictly work-related. Question 25. An RBT is asked to track how many times a client hits themselves during a session. Which measurement method should they use? A. Duration. B. Frequency. C. Latency. D. Partial interval. Answer B. Frequency. This question asks about measuring the count of a behavior. When you need to know how many times a behavior happens, the most appropriate measurement is frequency, or count. Duration is how long each instance lasts. Latency is the time before it starts after a cue. Partial interval is a discontinuous method, checking if it happened within an interval, which doesn't give you the exact count. Counting each instance of self-hitting is using frequency measurement. Remember, frequency is for behaviors you can easily count each time they happen. Question 26. When collecting ABC data on a behavior, it is important to describe the antecedent, behavior, and consequence in terms that are A. Interpretations of the client's feelings. B. Objective and observable. C. Only understandable to your supervisor. D. Focused on labels for the behavior. Answer B. Objective and observable. This question emphasizes the importance of objective data collection, specifically within the ABC framework. Just like defining a behavior, recording antecedents, behaviors, and consequences should be based on what you can see and hear, observable, and be factual, not based on your interpretations or opinions. Objective. This ensures accuracy and consistency in data collection across different observers. Interpretations of feelings are subjective. The descriptions need to be clear enough for anyone on the team to understand. Focusing on labels isn't specific enough. You need to describe the actual actions. For example, instead of writing antecedent, client seemed frustrated, you write antecedent. Therapist presented math worksheet. Here's the tip. When recording ABC, stick to observable facts. What happened? What was done? What happened next? Question 27. A type of prompt where the RBT points to the correct item or area is called A. Verbal prompt. B. Model prompt. C. Physical prompt. D. Gestural prompt. Answer D. Gestural prompt. This question asks about different prompt types. A gestural prompt involves using body language or movements, such as pointing, nodding, or looking towards the correct stimulus to guide the client's response. A verbal prompt uses words. A model prompt demonstrates the desired behavior. A physical prompt involves touching or guiding the client's body. Pointing is a non-vocal gesture that serves as a prompt. Think of someone pointing to the exit sign. That's a gestural prompt. Here's the takeaway. Gestural prompts are like using sign language or body signals to help the client. Question 28. You are teaching a client to identify objects. You hold up a ball and say, ball. The client says, ball, and you give them praise and the ball to play with briefly. Saying ball and presenting the ball to play with are examples of A. Antecedents. B. Behaviors. C. Consequences. D. Prompts. Answer C. Consequences. This question again uses the ABC model. The instruction ball and holding up the ball are the antecedents, SD. The client saying ball is the behavior or response. What happens after the client says ball, receiving praise, and getting the ball to play with, are the consequences. These consequences are functioning as reinforcement, making it more likely the client will say ball in the future when prompted. Prompts would be help given before or during the response. Remember, consequences are what follows the behavior and effect if it happens again. Question 29. Providing a reinforcer after a behavior occurs makes that behavior more likely to happen in the future. This describes the process of A. Punishment. B. Extinction. C. Reinforcement. D. Prompting. Answer: C. Reinforcement. This question is a fundamental definition in behavior analysis, the process by which a consequence makes a behavior more likely to occur in the future is called reinforcement. Punishment makes behavior less likely. Extinction decreases behavior by stopping reinforcement. Prompting is help given before the behavior. Whether the reinforcement is positive, adding something pleasant, or negative, removing something unpleasant, its function is to increase the future occurrence of the behavior it follows. Think of getting a bonus check, reinforcer, for working hard. Behavior: you'll likely work harder next time. Here's the core definition. Reinforcement increases the future likelihood of a behavior. Question 30. An RBT must maintain the confidentiality of client information. This means they should A. Discuss client progress openly with their friends. B. Share client information with the client's entire family, even distant relatives. C. Only discuss client information with their supervisor and authorized team members involved in the client's care. D. Post about interesting client behaviors on social media, without names. Answer: C. Only discuss client information with their supervisor and authorized team members involved in the client's care. This question is about the ethical principle of confidentiality. Confidentiality requires RBTs to protect client privacy and only share information with those who have a legitimate need to know for the purpose of providing services. This includes your direct supervisor and other professionals on the client's treatment team who are directly involved in their care. Discussing clients with friends, extended family members not involved in care, or posting about them, even anonymously, on social media violates confidentiality. Protecting client information is paramount. Think of patient confidentiality in healthcare. Information is only shared with the necessary medical team. Here's the key. Keep client information private and only share it with people directly on their treatment team under the guidance of your supervisor. Question 31. Reinforcing the first instance of a behavior after an unpredictable amount of time has passed is what type of reinforcement schedule? A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FAVI. T. Variable interval, VI. Answer: D. Variable interval, VI. This question asks about a specific time-based reinforcement schedule. Variable means the time changes unpredictably, and interval means reinforcement is based on time passing, not the number of responses. The reinforcement is delivered for the first behavior that occurs after that unpredictable time period is over. Fixed interval has a predictable time interval. Ratio schedules are based on response counts. An example of a VI schedule is waiting for a text message. You check your phone periodically, and the first time you check after a message arrives, which you don't know when that will be, you get the message. Reinforcement. These schedules tend to produce steady, moderate rates of behavior. Here's the tip. Variable interval means the time between reinforcements is unpredictable. Question 32. When a client is becoming overly reliant on prompts and not responding to the natural cue alone, this is called A. Fading. B. Shaping. C. Prompt dependency. D. Generalization. Answer: C. Prompt dependency. This question describes a potential issue that can rise when using prompts. Prompt dependency occurs when a client only performs the learned behavior when a specific prompt is given, even when the natural cue, SD, is present. They become reliant on the help instead of learning to respond to the original instruction or situation. Fading is the process of reducing prompts to prevent this. Shaping and generalization are different teaching concepts. Avoiding prompt dependency is why systematic prompt fading is a critical part of skill acquisition programming. Think of a student who can only answer a question when the teacher gives a specific hint. They might be prompt dependent. Here's the takeaway. Prompt dependency is when the client needs your help to do the skill, even when they should be able to do it on their own with just the instruction. Question 33. What is the purpose of collecting baseline data? A. To see how the client responds to the intervention. B. To determine the client's level of the skill or behavior before intervention starts. C. To compare the client's progress to other clients. D. To decide which reinforcers to use. Answer B. To determine the client's level of the skill or behavior before intervention starts. This question asks about the purpose of baseline data collection. Baseline data is collected on a skill or behavior before any intervention or teaching procedure is implemented. It provides a measure of the behavior's frequency, duration, etc., in its natural state or current level. This serves as a starting point against which you can compare data collected after the intervention begins to see if the plan is having an effect. Data collected during intervention shows response to treatment. Comparing clients isn't the purpose of individual baseline. Preference assessments find reinforcers. Baseline gives you the before picture. Think of taking a before photo when starting a project. That's your baseline to see the change later. Here's the tip. Baseline data is your starting point, showing what the behavior looks like before you try to change it. Question 34. You are teaching a client to make a sandwich. The steps are: get bread, get peanut butter, get jelly, spread peanut butter, spread jelly, put halves together, cut sandwich. This list of steps is called A. Behavior intervention plan. B. Preference assessment. C. Task analysis. D. Skill acquisition goal. Answer C. Task analysis. This question asks about the process of breaking down a complex skill into smaller sequential steps. A task analysis is the process of taking a complex skill and breaking it down into a sequence of individual teachable steps. This makes learning the skill easier because the client can master one step at a time or learn the whole sequence through chaining methods. A behavior intervention plan focuses on problem behaviors. A preference assessment finds reinforcers. A skill acquisition goal is the target behavior itself, not the steps to get there. Breaking down the skill into a list of steps is the definition of a task analysis. Think of following directions to build something. Each direction is a step in the task analysis. Here's the takeaway. A task analysis is breaking a big skill into little steps so it's easier to teach. Question 35. Which ethical guideline requires RBTs to act in the best interest of the client and promote their welfare? A. Non-maleficence. B. Confidentiality. C. Beneficence. D. Responsible conduct. Answer C. Beneficence. This question asks about the ethical principle focused on doing good for the client. Beneficence means working to benefit others and promote their welfare. For RBTs, this involves using effective, evidence-based procedures, working towards goals that improve the client's life, and advocating for their best interests. Non-maleficence is about avoiding harm. Confidentiality is about privacy. Responsible conduct is broad professional behavior. Choosing interventions that are proven to be effective and help the client grow and succeed aligns with the principle of beneficence. Think of a charity organization whose goal is to help people. That's beneficence in action. Here's the tip. Beneficence is all about actively working to do what's best for the client. Question 36. If a client engages in a behavior and, as a result, they gain access to a preferred item or activity, example, asks for a toy and gets the toy, and the behavior increases in the future, this is an example of A. Automatic reinforcement. B. Positive reinforcement. Tangible. C. Negative reinforcement. D. Punishment. Answer B. Positive reinforcement. Tangible. This question describes a specific type of positive reinforcement, where the consequence is gaining access to a tangible item or activity. Positive reinforcement means adding a stimulus after a behavior makes the behavior more likely in the future. In this case, the pleasant stimulus added was the preferred toy/activity. The question specifies the behavior leads to getting an item, fitting the tangible function. Negative reinforcement involves removing something unpleasant. Punishment decreases behavior. Automatic reinforcement happens when the behavior itself produces the reinforcement. Example, flapping hands is reinforcing because it looks or feels good, not from another person providing an item. Since something desirable was added and the behavior increased, and it's gaining a tangible item, it's positive reinforcement. Tangible. Remember, positive reinforcement adds something good, and if it's a toy or item, it's often called tangible reinforcement. Question 37. When you collect data on a behavior by checking if it is occurring at the exact moment each interval ends, this is called A. Partial interval recording, B. Whole interval recording, C. Momentary time sampling, D. Frequency. Answer: C. Momentary time sampling. This question asks about a specific discontinuous measurement method. Momentary time sampling involves setting intervals and observing the client only at the very end of each interval. You record if the behavior is happening right at that moment. Partial interval records if it happens at any point during the interval. Whole interval records if it happens for the entire duration of the interval. Frequency is continuous counting. MTS is often used when an RBT is busy doing other things and can only pause to check the behavior at specific times. Think of glancing at your watch at the top of every hour to see if someone is still sitting in their chair. Here's the tip. Momentary means you just check for the behavior for a brief moment at the end of the interval. Question 38. The process of teaching a client to tell the difference between two or more stimuli. Example, touching a red card when you say red but not when you say blue is called A. Generalization, B. Discrimination training, C. Shaping, D. Chaining. Answer: B. Discrimination training. This question asks about a teaching procedure focused on responding differently to different cues or stimuli. Discrimination training involves reinforcing a behavior in the presence of one stimulus, the SD, and withholding reinforcement or using extinction for that same behavior in the presence of another stimulus, the S delta. This teaches the client to discriminate or tell the difference between the stimuli and respond only when the correct one is present. Generalization is responding similarly to different stimuli. Shaping teaches new behaviors. Chaining teaches sequences. Teaching a child to say car only when they see a car and not when they see a truck is discrimination training. Remember, discrimination is about learning to respond differently to different things. Question 39. If a client engages in a problem behavior and as a result, a demand is removed, example, they scream and you take away the worksheet, and the problem behavior increases in the future, this is an example of A. Automatic reinforcement, B. Positive reinforcement, C. Negative reinforcement, escape, D. Positive punishment. Answer: C. Negative reinforcement, escape. This question describes negative reinforcement, specifically the function of escape. Negative reinforcement increases a behavior by removing an unpleasant stimulus. In this scenario, the unpleasant stimulus is the demand, the worksheet, and the behavior, screaming, leads to the removal of that demand. Because the screaming increased in the future when presented with a demand, it was reinforced by escaping the task. Positive reinforcement adds something pleasant. Punishment decreases behavior. Automatic reinforcement doesn't involve others. This is a classic example of a behavior maintained by escape from a demand. Here's the takeaway. Negative reinforcement can involve escaping from something you don't like, which makes the behavior you use to escape happen more. Question 40. An RBT is working with a client when the client begins to engage in a severe problem behavior that the RBT is not trained to handle. What should the RBT do? A. Attempt to implement a procedure they saw in a training video. B. Immediately implement a planned emergency procedure or seek assistance from a supervisor/designated person. C. Leave the room until the behavior stops. D. Restrain the client until they calm down. Answer. B. Immediately implement a planned emergency procedure or seek assistance from a supervisor/designated person. This question addresses handling crisis or emergency situations, emphasizing safety and following protocols. RBTs are trained on specific crisis or emergency procedures outlined in the client's plan or company policy, and they are taught when and how to seek help from their supervisor or other designated personnel. Attempting procedures without training is unsafe and unethical. Leaving the client alone during a dangerous behavior is neglectful. Restraint should only be used as a last resort by trained personnel following strict guidelines, never as a default response or solely to calm a client. Client safety and following established protocols for emergencies are critical. Here's the crucial point. In a crisis, your priority is safety. Follow the emergency plan and get help from your supervisor or trained staff. Question 41. When creating a behavior definition, complete means A. It includes all possible examples and non-examples of the behavior. B. It is written on a single page. C. It describes why the behavior occurs. D. It lists all the consequences of the behavior. Answer. A. It includes all possible examples and non-examples of the behavior. This question is about another quality of a good behavior definition, being complete. A complete definition includes clear examples of what is the behavior and what is not the behavior, non-examples. This helps observers know exactly what to count and what not to count, reducing confusion and ensuring accuracy. It's not about length, explaining the function, why it happens, or listing all consequences. A complete definition leaves little room for interpretation about what behaviors fit the definition. For example, if defining hitting, a complete definition might specify hitting with a closed or open hand. Examples and exclude accidentally bumping into someone, non-example. Here's the tip. A complete definition covers all the bases, telling you exactly what counts and what doesn't. Question 42. You are using a token economy. The tokens a client earns for completing tasks are considered what type of reinforcer? A. Unconditioned reinforcer. B. Primary reinforcer. C. Generalized conditioned reinforcer. D. Automatic reinforcer. Answer. C. Generalized conditioned reinforcer. This question asks about the type of reinforcer used in token economies. The tokens themselves, stickers, points, etc., are not naturally reinforcing, like food or water are. They gain their reinforcing power because they are paired with and can be exchanged for many different other reinforcers that the client likes, backup reinforcers. This makes them generalized conditioned reinforcers. They are conditioned, learned, and generalized because they can be exchanged for various things. Unconditioned or primary reinforcers, like food, water, shelter, are naturally reinforcing. Automatic reinforcers are produced by the behavior itself. Tokens are valuable because of what they can be traded for. Remember, tokens are special because they can be swapped for lots of different rewards. Question 43. If a behavior occurs and a stimulus is added immediately following the behavior, and the behavior increases in the future, this is an example of A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer. A. Positive reinforcement. This question reiterates the definition of positive reinforcement. Reinforcement means the behavior increases in the future. Positive means a stimulus was added or presented after the behavior. If you give a child a cookie, pleasant stimulus added. When they say cookie, behavior, and they say cookie more often, that's positive reinforcement. Negative reinforcement removes an unpleasant stimulus to increase behavior. Punishment decreases behavior. The effect on future behavior, increase, combined with the action, adding stimulus, tells you it's positive reinforcement. Here's the rule. Reinforcement makes behavior go up. Positive adds something. Put them together. Positive reinforcement adds something good to make behavior go up. Question 44. When a behavior put on extinction suddenly reappears after some time has passed, this is called A. Extinction burst, B. Spontaneous recovery, C. Generalization, D. Punishment. Answer: B. Spontaneous recovery. This question describes spontaneous recovery, a phenomenon that can occur after a behavior has been successfully decreased or eliminated using extinction. It's the temporary and often unexpected reappearance of the extinguished behavior after a period of time when it didn't occur. The behavior is usually less intense or frequent than it was before extinction, and will typically disappear again if still not reinforced. An extinction burst is the temporary increase right after extinction starts. Generalization is responding in new situations. Punishment decreases behavior. Spontaneous recovery is like an old habit making a brief comeback. Here's the tip. Spontaneous recovery is the behavior making a surprising return visit after you thought it was gone. Question 45. The RBT is teaching a client to put their shoes on using total task chaining. This means A. The RBT will teach only the first step until mastered. B. The RBT will teach only the last step until mastered. C. The client is prompted through all steps of the chain in order during every trial. D. The client receives reinforcement only after completing the very last step independently. Answer: C. The client is prompted through all steps of the chain in order during every trial. This question asks about the total task chaining method for teaching skills made of multiple steps. In total task chaining, the client is given the opportunity to perform every step of the task analysis during every teaching trial. The RBT provides prompts as needed for each step, fading prompts as the client masters them. Reinforcement is usually given upon completion of the last step or after a certain number of steps are completed correctly, depending on the plan. Forward chaining teaches steps from first to last, one at a time. Backward chaining teaches from last to first. Shaping isn't for chains. Total task is about practicing the whole sequence every time. Think of practicing a dance routine by going through all the steps from beginning to end in every rehearsal, getting help on the parts you miss. Here's the takeaway. Total task means working on the entire skill from start to finish in every practice attempt. Question 46. When should an RBT review the client's behavior intervention plan? A. Only when problem behavior occurs. B. Only before the first session with the client. C. Regularly, as part of preparing for sessions and as needed for clarity. D. Never. The supervisor will tell them what to do. Answer: C. Regularly, as part of preparing for sessions and as needed for clarity. This question addresses the RBT's responsibility to be familiar with the client's plan. RBTs must understand and follow the behavior intervention plan, BCaBAs, and skill acquisition plans. This requires reviewing them regularly, not just once, to stay current on goals, procedures, and any updates. Reviewing the plan before each session or set of sessions helps ensure consistent implementation. RBTs also need to refer back to the plan if they are unsure about how to handle a situation or collect data. Relying solely on verbal instructions without referring to the written plan can lead to errors. Think of a musician reviewing their sheet music before practice or a performance. You need to know the plan to perform correctly. Here's the tip. Treat the behavior plan like your map. Check it often to make sure you're going the right way. Question 47. If a behavior occurs and an unpleasant stimulus is removed immediately following the behavior, and the behavior increases in the future, this is an example of A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer: B. Negative reinforcement. This question defines negative reinforcement. Reinforcement means the behavior increases in the future. Negative means a stimulus was removed or taken away. In this case, an unpleasant stimulus was removed after the behavior, and the behavior increased. Positive reinforcement adds a pleasant stimulus. Punishment decreases behavior. If hitting the snooze button, behavior, stops the annoying alarm, unpleasant stimulus removed, and you hit snooze more often in the future, that's negative reinforcement. The removal of the unpleasant stimulus made the behavior more likely. Here's the rule: reinforcement makes behavior go up. Negative takes something away. Put them together. Negative reinforcement takes away something bad to make behavior go up. Question 48. A client's tantrum typically lasts for about 5 to 10 minutes. To measure this behavior, the RBT should primarily use A. Frequency. B. Duration. C. Latency. D. Permanent product. Answer: B. Duration. This question asks the best measurement method for a behavior described by its length. The phrase lasts for about 5 to 10 minutes directly tells you that the important dimension of the behavior is its duration. Frequency counts how many times it happens, not how long. Latency is the time to start. Permanent product measures the outcome. Tantrums are behaviors that happen over a period of time, so measuring how long they last is the most appropriate method to track changes in the behavior's length. Think of timing how long a race car drives. You measure the duration it takes to complete the course. Here's the tip. If you care about how long a behavior goes on, use duration measurement. Question 49. A stimulus that signals that reinforcement is available for a specific behavior is called a S delta, SD. B. Punisher. C. Discriminative stimulus, SD. D. Motivating operation, MO. Answer: C. Discriminative stimulus, SD. This question defines the discriminative stimulus, SD, a key term in understanding stimulus control. An SD is an environmental stimulus that, because of past reinforcement history, signals to the individual that a particular behavior is likely to be reinforced if performed in the presence of that stimulus. It's like a green light for a specific action. An S delta, SD, signals reinforcement is not available. Punishers decrease behavior. Motivating operations change the value of reinforcers. If you teach a child to touch a red card when you say touch red, saying touch red becomes the SD for touching the red card because they have been reinforced for that action in the past. Remember, the SD is the cue that tells you now is the time. If you do the behavior, you'll get the good stuff. Question 50. An RBT is using a skill acquisition program that says the mastery criterion is 80% correct for 2 consecutive sessions. What does this mean? A. The client should get 80% correct in total trials across all sessions. B. The client must perform the skill with 80% accuracy or higher in 2 sessions in a row. C. The client must perform the skill perfectly, 100% correct, in 2 sessions. D. The client must perform the skill for 80 minutes across sessions. Answer: B. The client must perform the skill with 80% accuracy or higher in 2 sessions in a row. This question explains mastery criteria, which specify when a skill is considered learned well enough to move on or be considered mastered. A mastery criterion of 80% correct for 2 consecutive sessions means the client must perform the target skill correctly at least 80% of the opportunities in 1 session, and then perform it at 80% accuracy or higher again in the very next session. Both sessions must meet or exceed the 80% threshold consecutively. It's not about a total percentage across many sessions, achieving 100% or measuring duration. This ensures the client has consistently learned the skill before teaching stops or moves to generalization. Think of passing a test. You need to get a certain score, and sometimes you need to get that score on 2 tests in a row to prove you really know it. Here's the tip. Mastery criterion tells you exactly when the client is done learning that specific step or skill, and consecutive sessions means back-to-back successes. Question 51. Which ethical guideline requires RBTs to accurately represent their credentials, training, and experience? A. Maintaining competence. B. Responsible conduct. C. Confidentiality. D. Professional boundaries. Answer. B. Responsible conduct. This question relates to the ethical principle of professional integrity and honesty. Responsible conduct includes being truthful about your qualifications, training, and experience. RBTs must not misrepresent themselves or claim to have certifications or skills they do not possess. This is part of acting professionally and honestly in your role. Maintaining competence is about ongoing learning. Confidentiality is about privacy. Professional boundaries are about relationships. Being upfront and accurate about your role and abilities is a core part of responsible conduct. Think of being honest on your resume or job application. You accurately represent your qualifications. Here's the takeaway. Responsible conduct means being honest and acting with integrity in your professional life. Question 52. You are teaching a client to complete a puzzle. You break it down into small steps. Pick up piece, find matching shape, push piece in, etc. This is part of using A. Preference assessment. B. Functional behavior assessment. C. Task analysis. D. Schedule of reinforcement. Answer. C. Task analysis. This question describes the first step in teaching a multi-step skill, breaking it down. Just like with washing hands or making a sandwich, taking a complex skill like completing a puzzle and listing the individual steps required to do it is creating a task analysis. This is the foundation for teaching the skill using chaining methods. Preference assessments find reinforcers. FBAs figure out the function of behaviors. Schedules of reinforcement determine when reinforcement is given. Breaking down a skill into a sequence of smaller steps is the process of task analysis. Remember, task analysis means breaking a task down into its bite-sized steps. Question 53. A client engages in a behavior that results in attention from the therapist. Example, saying a silly phrase makes the therapist laugh. If this behavior increases in the future, the attention acted as A. Automatic reinforcement. B. Positive reinforcement. Attention. C. Negative reinforcement. D. Positive punishment. Answer. B. Positive reinforcement. Attention. This question describes positive reinforcement, where the consequence is attention. Positive reinforcement increases a behavior by adding a stimulus. In this case, the pleasant stimulus added was the therapist's attention, laughing. Because the silly phrase behavior increased in the future, the attention functioned as a positive reinforcer. When the reinforcement involves getting attention from others, it's often referred to as attention-maintained behavior. Automatic reinforcement doesn't involve social interaction. Negative reinforcement involves removing something unpleasant. Positive punishment adds something unpleasant to decrease behavior. Since attention was added and the behavior increased, it's positive reinforcement. Specifically, it's attention. Here's the takeaway. If getting a reaction from someone makes the behavior happen more, that reaction was likely positive reinforcement. Attention. Question 54. Collecting data on the time from the end of one response to the beginning of the next instance of the same response is called A. Latency. B. Duration. C. Inter-response time, IRT. D. Frequency. Answer. C. Inter-response time, IRT. This question asks for the specific measure of the time between consecutive occurrences of the same behavior. Inter-response time, IRT. is the time that passes between the end of one instance of a behavior and the start of the very next instance of that same behavior. Latency is time from a cue to the first response. Duration is how long one response lasts. Frequency is the count. IRT is useful for behaviors that happen in bursts or sequences, like measuring the time between bites of food or words in a sentence. Think of the pause button between actions. Here's the tip. IRT is the time between occurrences of the same response. Question 55. Providing reinforcement only for desired behaviors while withholding reinforcement for challenging behaviors is called A. Punishment. B. Extinction. C. Differential reinforcement. D. Spontaneous recovery. Answer: C. Differential reinforcement. This question describes the overarching principle of differential reinforcement. This term refers to any procedure where you reinforce one behavior or set of behaviors and simultaneously put another behavior, typically the challenging one. On extinction, you are differentiating which behaviors get reinforced. Specific types include DRA, reinforcing an alternative behavior; DRO, reinforcing any other behavior / absence of problem behavior; DR/DRL, reinforcing high / low rates. Punishment adds a consequence to decrease behavior. Extinction is just stopping reinforcement for a behavior. Spontaneous recovery is the reappearance of behavior after extinction. Differential reinforcement is a core strategy for both increasing desired behaviors and decreasing unwanted ones by reinforcing the good ones while ignoring or blocking the reward for the bad ones. Think of praising a child for asking nicely, reinforce, while ignoring their whining, extinction. You're using differential reinforcement. Here's the takeaway. Differential reinforcement is about reinforcing the good stuff instead of the bad stuff. Question 56. Which ethical standard guides RBTs to work within their training and seek supervision for tasks outside their competence? A. Confidentiality. B. Professional boundaries. C. Maintaining competence. D. Beneficence. Answer: C. Maintaining competence. This question is about the ethical requirement to have the necessary skills and knowledge for your job. Maintaining competence means ensuring you have the training and skills to perform your responsibilities effectively and ethically. It also means recognizing when you lack the necessary competence for a task and seeking appropriate training or supervision from a qualified professional. Confidentiality is about privacy. Professional boundaries are about relationships. Beneficence is about doing good. Only performing tasks you are trained for and seeking help when needed is central to maintaining competence. Think of any skilled job. You have to be trained and know when you need help or more training. Here's the tip. Maintaining competence means knowing what you're good at, doing it well, and getting help or training for things you're not. Question 57. Reinforcement is delivered after a specific, predictable amount of time has passed, and the first response after that time is reinforced. This is a blank schedule of reinforcement. A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FI. D. Variable interval, VI. Answer: C. Fixed interval, FI. This question describes a fixed interval schedule. Fixed means the time is predictable, and interval means the reinforcement is based on time passing. The reinforcement is delivered for the first response that occurs after the set time period is over. Fixed ratio and variable ratio schedules are based on response count, not time. Variable interval has unpredictable time intervals. An example of an FI schedule is getting paid every Friday, reinforcement, as long as you've done some work. The first response after Friday arrives. Response rates often pick up as the end of the interval approaches. Here's the reminder. Fixed interval means the time between reinforcements is set and predictable. Question 58. When using extinction for a behavior that was previously reinforced with attention, what should happen when the behavior occurs? A. Provide attention, but only briefly. B. Provide attention and a reprimand. C. Withhold attention. D. Ignore the client completely. Answer: C. Withhold attention. This question is about implementing extinction when the function of the behavior is attention. Extinction involves stopping the reinforcement that was maintaining the behavior. If a behavior was happening because it got attention, the extinction procedure is to withhold or stop providing that attention when the behavior occurs. Giving brief attention, attention with a reprimand, or ignoring the client for everything might not be the correct application. The key is to eliminate the specific consequence, attention, that was reinforcing the target behavior. For example, if crying got attention, you implement extinction by not providing attention, or providing it for other behaviors when the client cries. Here's the tip. Extinction means cutting off the specific thing the behavior was getting. If it was attention, stop giving attention for that behavior. Question 59. The ethical guideline of do no harm is most closely related to A. Beneficence, B. Fidelity, C. Non-maleficence, D. Justice. Answer: C. Non-maleficence. This question asks about the ethical principle of avoiding harm. Non-maleficence is the principle that healthcare providers and therapists have an obligation to avoid causing harm to their clients. While beneficence is about doing good, non-maleficence is specifically about preventing harm. Fidelity is about being trustworthy. Justice is about fairness. For RBTs, this means using safe procedures, not implementing interventions that could be harmful, and prioritizing client safety at all times. It's a foundational principle. Think of the medical motto, first, do no harm. Here's the tip. Non-maleficence is the formal term for the rule to avoid causing harm. Question 60. When teaching a multi-step skill, reinforcing the completion of the entire chain of steps in order during every trial is called A. Forward chaining, B. Backward chaining, C. Total task chaining, D. Shaping. Answer: C. Total task chaining. This question describes the total task chaining method again. In total task chaining, you present the opportunity for the client to perform all steps of the task analysis from beginning to end in each trial. You provide prompts for any steps the client cannot do independently and fade those prompts over time. Reinforcement is typically delivered once the entire chain is completed correctly. Forward chaining teaches step 1, then 1 plus 2, etc. Backward chaining teaches the last step first. Shaping teaches new behaviors. Total task is about practicing the whole sequence in every attempt. Think of teaching someone to clean a room by having them go through every step, picking up toys, dusting, vacuuming, in order each time, helping them with the steps they struggle with. Here's the reminder. Total task means practicing the whole job from start to finish every single time. Question 61. What should you do if your supervisor asks you to collect data using a method you've never used before? A. Guess how to do it based on the data sheet. B. Tell them you can't do it and refuse. C. Ask your supervisor for training and clear instructions on the data collection method. D. Collect data using a method you are familiar with instead. Answer: C. Ask your supervisor for training and clear instructions on the data collection method. This question relates to the RBT's responsibility to maintain competence and communicate effectively with their supervisor. If you are given a task or procedure you don't know how to do, you should ask your supervisor for training and clarification. Guessing data collection methods is inaccurate and unethical. Refusing without asking for training is not professional. Substituting a different method isn't following the plan. Your supervisor is there to provide guidance and training. It's your responsibility to let them know when you need help to perform your job correctly. Think of being given a new piece of equipment at work. You need to ask for instructions on how to use it properly. Here's the takeaway. Never guess on data collection. Ask your supervisor for training if you're unsure. Question 62. Reinforcement that occurs as a natural result of the behavior itself, without another person providing a consequence, example, flapping hands because it feels good or hitting a switch turns on musicy, is called A. Socially mediated reinforcement, B. Tangible reinforcement, C. Automatic reinforcement, D. Escape reinforcement. Answer C. Automatic reinforcement. This question describes automatic reinforcement. Automatic reinforcement happens when the behavior produces its own consequence without the involvement of another person. The reinforcement is built into the behavior or the immediate environment changed directly by the behavior. Socially mediated reinforcement is delivered by another person, like attention or tangible items. Tangible reinforcement is getting an item from someone else. Escape reinforcement is ending or avoiding an unpleasant situation, usually mediated by another person or the environment changing in a way that requires action beyond the behavior itself. If a behavior feels good, looks cool, or directly changes the environment, like turning on music by hitting a switch, and that consequence makes the behavior happen more, it's automatic reinforcement. Remember, automatic reinforcement means the behavior is reinforcing itself. No one else is needed to provide the payoff. Question 63. When a behavior is reinforced after an average of a certain number of responses, but the exact number varies, this is A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, phi. D. Variable interval, VI. Answer B. Variable ratio, VR. This question is another check on variable ratio schedules. The key phrase average of a certain number of responses, and exact number varies points directly to VR. Fixed ratio uses a set number. Interval schedules use time. Variable ratio uses a changing number of responses that averages out over time. These schedules are powerful because the unpredictability keeps the rate of behavior high. Think of hitting the refresh button on your email or social media. You don't know how many times you'll refresh before something new appears, but you keep trying. Here's the tip. Variable ratio means the number changes, keeping you guessing and responding. Question 64. An RBT is working on teaching a client to greet others. The goal is for the client to say hi or hello when someone says hi to them. The supervisor tells the RBT that mastery is achieved when the client greets the person on 4 out of 5 opportunities across 3 consecutive people who greet them. This is an example of A. Stimulus control, B. Mastery criterion, C. Generalization, D. Discrimination. Answer B. Mastery criterion. This question describes a specific measure used to determine when a skill is considered learned to a sufficient level. The detailed description of the expected performance, 4 out of 5 opportunities across 3 consecutive people, is setting the mastery criterion for that skill. It specifies the level of accuracy and the conditions under which the skill must be performed consistently to be considered mastered. Stimulus control is the behavior happening reliably in the presence of the SD. Generalization is the skill happening in new situations / with new people, which the criterion includes assessing. Discrimination is responding differently to different stimuli. The criterion is the rule for deciding when teaching is complete for that specific goal. Here's the takeaway. The mastery criterion tells you exactly how well and how consistently the client needs to do the skill before you can say they've learned it. Question 65. Which measurement method is best for behaviors that occur at a very high rate, like hand flapping, or don't have a clear start and end, like humming? A. Frequency. B. Duration. C. Partial interval recording. D. Latency. Answer C. Partial interval recording. This question asks about selecting an appropriate measurement method for certain types of behaviors. Partial interval recording is often used for behaviors that occur at high rates or don't have distinct starts and ends because counting every instance, frequency, or timing every instance, duration, would be difficult or impractical. By just marking if the behavior happened at all during a short interval, you can get an estimate of how often it's occurring, even if it's happening constantly or too quickly to count precisely. Frequency and duration are continuous and hard for high-rate/indistinct behaviors. Latency measures time to start. Partial interval gives a usable estimate when other methods are too difficult. Think of trying to count every single hop a child does during playtime. It's easier to just mark every 30 seconds if they hopped at all during that time. Here's the tip. For fast or blurry behaviors, interval recording, like partial, can give you a good snapshot without needing to track every second. Question 66. Which ethical guideline requires RBTs to protect the health, safety, and welfare of their clients? A. Confidentiality. B. Maintaining competence. C. Responsible conduct. D. Beneficence and non-maleficence. Answer. D. Beneficence and non-maleficence. This question relates to the ethical principles that directly address the client's well-being. Both beneficence, doing good, and non-maleficence, avoiding harm, are foundational principles that guide behavior analysts and RBTs in prioritizing the client's health, safety, and overall welfare. You must actively work to improve the client's life, beneficence, and ensure you are not causing them harm. Non-maleficence. Responsible conduct is a broader principle. Confidentiality is about privacy, and maintaining competence is about your skills. The core ethical obligation to keep clients safe and promote their well-being is captured by these two principles together. Think of any helping profession. The safety and well-being of the person being helped are paramount. Here's the takeaway. Beneficence and non-maleficence are the principles that say you must help clients and protect them from harm. Question 67. What is the definition of behavior in ABA? A. How a person feels internally. B. What a person says or does that is observable and measurable. C. A person's thoughts and intentions. D. Any action that is difficult or inappropriate. Answer. B. What a person says or does that is observable and measurable. This question asks for the precise definition of behavior from an ABA perspective. In ABA, behavior is defined as anything a living organism says or does that can be observed and measured. We focus on outward actions, not internal feelings, thoughts, or intentions, because only observable behaviors can be objectively studied and changed. It's not limited to difficult or inappropriate actions. All actions, talking, walking, looking, thinking, if measured as verbal behavior, are behaviors. This objective definition is crucial for applying ABA principles. Think of a scientist studying something. They measure what they can directly see or detect. Here's the core idea. In ABA, behavior is just action, what you see and hear someone do. Question 68. An RBT is teaching a client to imitate actions. The RBT says, "Do this," then claps their hands. The client claps their hands. Saying "do this" and clapping hands is the A. Behavior. B. Consequence. C. Antecedent, specifically the SD and a model prompt. D. Reinforcer. Answer. C. Antecedent, specifically the SD and a model prompt. This question uses the ABC model in a teaching scenario. The events that happen before the client's response are the antecedents. In this case, "do this" is the instruction, the SD, and the RBT clapping their hands is also an antecedent, serving as a model prompt for the client to imitate. The client's clapping is the behavior/response. The consequence would be whatever happens after the client claps. Like praise, reinforcers are consequences that increase future behavior. So, the "do this" and clapping model are the stimuli presented before the behavior is expected, making them antecedents. Here's the takeaway. The antecedent is whatever happens right before you expect the client to do the behavior. In teaching, the instruction and any prompts are antecedents. Question 69. Reinforcement is delivered after an average of a certain amount of time has passed. but the exact time varies. This is a blank schedule of reinforcement. A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FI. D. Variable interval, VI. Answer D. Variable interval, VI. This question is another look at variable interval schedules. The key phrases are average of a certain amount of time and exact time varies. This signifies a VI schedule. Fixed ratio and variable ratio are based on response counts. Fixed interval has predictable time intervals. Variable interval has unpredictable time intervals that average out to a certain length. Waiting for an elevator or a bus, if they don't run on a strict schedule, are often on VI schedules. You don't know exactly when the next one will come, but you know it's probably around every X minutes on average. These schedules produce steady rates of behavior. Here's the reminder. Variable interval means the time is unpredictable, but there's an average wait time. Question 70. Providing support and guidance to an RBT by a BCBA or BCABA is called A. Training. B. Supervision. C. Management. D. Counseling. Answer B. Supervision. This question asks for the specific term for the required oversight of RBTs by certified behavior analysts. Supervision is the professional relationship where a BCBA or BCABA guides, trains, and oversees the work of an RBT to ensure they are implementing procedures correctly, maintaining ethical standards, and developing their skills. While training is part of it, the ongoing process is called supervision. Management might involve administrative oversight, but isn't the clinical guidance. Counseling is therapeutic. Supervision is a specific requirement for RBT certification and practice. Think of a student gaining supervised hours to become licensed in a profession. It's directed guidance from a certified professional. Here's the tip. RBTs are required to have regular supervision from a BCBA or BCABA. Question 71. When using a continuous measurement method, you record A. Only if the behavior occurred during an interval. B. Every instance of the behavior or its duration/latency. C. Only the product of the behavior. D. The behavior only when it is severe. Answer B. Every instance of the behavior or its duration/latency. This question defines continuous measurement. Continuous measurement involves recording data on every single occurrence of the behavior, or the exact duration or latency of every instance, as it happens. Frequency, duration, and latency are continuous measurement methods. Discontinuous methods, like interval recording, sample the behavior. Permanent product measures the outcome, not the behavior as it happens. Only recording severe instances isn't truly measuring the behavior consistently. Continuous measurement provides the most accurate picture of the behavior's occurrence. Think of a stopwatch timing every lap in a race or a counter clicking every time something enters a box. You're recording every single event. Here's the takeaway. Continuous measurement means you're tracking every time, or for the whole time the behavior happens. Question 72. When should an RBT report client progress to their supervisor? A. Only when the client reaches a mastery criterion. B. Only when problem behavior gets worse. C. Regularly, according to the supervision schedule and as requested by the supervisor. D. Never, the supervisor gets the data directly. Answer C. Regularly, according to the supervision schedule and as requested by the supervisor. This question addresses the RBT's responsibility for communication with their supervisor. RBTs are required to report client progress, data, and any issues to their supervisor regularly. This reporting should happen during scheduled supervision meetings and whenever the supervisor requests updates. You don't wait only for milestones or problems. Regular reporting is essential for the supervisor to monitor progress and make necessary adjustments to the treatment plan. While supervisors review data, the RBT often provides context and observations during reporting. Think of a team member reporting their tasks and progress during a regular team meeting. Here's the tip. Keep your supervisor updated on client progress and any concerns on a regular basis, not just when something big happens. Question 73. The process of reinforcing a behavior only in the presence of a specific stimulus, the SD, and not in the presence of other stimuli, S deltas, is called A. Generalization, B. Stimulus control, C. Shaping, D. Fading. Answer: B. Stimulus control. This question defines stimulus control. Stimulus control is when a behavior occurs more often in the presence of a specific stimulus, the SD, than in its absence or in the presence of other stimuli, S deltas, because it has been reinforced only in the presence of that SD. It means the stimulus has gained control over the behavior, signaling when it's appropriate or likely to be reinforced. Generalization is responding to similar stimuli. Shaping teaches new behaviors. Fading is reducing prompts. When a child learns to say stop only when a stop sign is present, SD, and not when a yield sign is present, S delta. The stop sign has stimulus control over saying stop. Here's the tip. Stimulus control is when a certain cue or situation makes a behavior happen reliably. Question 74. Which ethical guideline requires RBTs to avoid using their position to exploit clients or gain unfair advantage? A. Beneficence, B. Professional boundaries, C. Confidentiality, D. Responsible conduct. Answer: D. Responsible conduct. This question is about the ethical principle of acting honestly and avoiding exploitation. Responsible conduct includes professional integrity, avoiding conflicts of interest that could lead to exploitation, and not taking advantage of clients or their families in any way, financial, personal, etc. Beneficence is doing good, professional boundaries are about relationships, and confidentiality is about privacy. Ensuring fairness, honesty, and not misusing your role falls under acting responsibly as a professional. Think of a professional not charging unfairly or using insider information for personal gain. Here's the takeaway. Responsible conduct includes making sure you are always fair and never take advantage of your client. Question 75. A type of prompting where the RBT provides a vocal cue or hint to help the client respond correctly is called A. Physical prompt, B. Model prompt, C. Verbal prompt, D. Gestural prompt. Answer: C. Verbal prompt. This question asks about a specific type of prompt using spoken words. A verbal prompt involves using spoken language to guide the client's response. This could be giving the full answer, giving part of the answer, giving a hint, or asking a question that leads to the answer. Physical prompts use touch. Model prompts demonstrate the behavior. Gestural prompts use pointing or body language. Saying the animal says moo as a hint to identify a cow is a verbal prompt. Remember, verbal prompts use your voice to give the client a clue or the answer,